Hi everyone, I'm Marciana. Welcome to my channel. Excuse my voice. I am a little hoarse today, a little under the weather. The weather keeps changing here in Atlanta, and so it got me a little sick. But I wanted to make a medical terminology video. A lot of my future videos will be about coding. I have a lot of interview videos on my channel, but a lot of my future videos, like I said, is going to be about coding. So I want to kind of start from the beginning. Now, a lot of you guys might be advanced and might be past this stage, so this video may not be particularly for you. This video is for people who want to understand the basics of medical terminology to help them better understand larger terms and things like that when you're talking about conditions, diseases, specialists, and things like that. Also treatments of things, stuff like that. So medical terminology, I know, definitely helped me pass my CPC. So for those of you who do not know, I have my CPC certification, certified coder. So like I said, we'll be talking about billing sometimes and we'll talk about coding. But again, today's video is about understanding and breaking down medical terminology. So I wrote a lot of notes, and I would suggest or recommend that you guys grab pen and paper so you can take some notes, because there's going to be some good information that I'm sure is going to help you for the CPC exam. So the thing I like to tell people about the CPC exam, if you don't know, first of all, it is 150 questions. And it's 5 hours and it's 40 minutes. Yes, initially I was like, oh my God, who needs 5 hours, 40 minutes, almost 6 hours to complete 150 questions? Yes, you need that much time. A lot of times people don't think so. And when they get there, it's like, oh, 20 more minutes. You're like, where did the time go? So the exam consists of different categories, different subjects, of course. So I like to tell people to focus on the easier subjects. And if you do really, really well in the easier subjects, then it allows you room to kind of slack off, sort of say, on other subjects and still be able to pass with an overall score of 70. So today we'll talk about medical terminology, and I'm going to break it down. So there are 3 basic parts to a medical term. You're going to have a word root, which is usually the middle of the word or the central meaning of the word. And then we're going to have a prefix, which comes in the beginning, usually identifies kind of subdivision of part of the central meaning. And then we're going to have suffixes. And it comes at the end of the word. It kind of modifies the central meaning as to what or who is interacting with it or what is happening to it. So that's the suffix. So for example, therm. Therm is heat. Hypothermia. Hypo, less heat. In this word tense, we're talking about hypothermia. So this is going to be, hypo means under or low. So this is going to be less heat. Thermometer, measuring of heat. So hypothermia. So words like that. Another example can be myocarditis. And that is myo, M-Y-O, breaks down to mean muscle. Card, of course, like cardio, cardiology. Card means heart. So itis is inflammation, like arthritis. That's the inflammation of your joints, because arthro, A-R-T-H-R-O, arthro is your joints. So arthritis is inflammation, itis, inflammation of your joints. So I'll go over some frequently used word beginnings, like prefixes, and word endings, suffixes, used to make up many medical terms. So one you'll see a lot frequently, itis. Just talked about it. I-T-I-S, itis. Itis means inflammation. Example, tonsillitis, inflammation of your tonsils. Appendicitis, inflammation of your appendix. Itis, I-T-I-S. So osis is another one. So osis is abnormal condition. So cyanosis, which is means kind of blueness due to cold or low oxygen. So OSIS, abnormal condition, osis. So otomy, OTOMY. So it means to cut into, like tracheotomy, to cut into the windpipe or a temporary opening. So that's going to be OTOMY. So ostomy. So ostomy means like to make a quote unquote mouth or opening. So like a colostomy bag, to make a permanent opening in the colon. So I'm sure you guys have heard of colostomy bags. So A or an means without or none, like anemia. Anemia is literally no blood, but kind of means few blood cells, few red cells. So micro, MICRO, micro means small. So microstomatia, or abnormality or small mouth, like we just said, like an ostomy, like in a colostomy. So macro, MACRO means large. Macro means large. Okay. Example, colonoscopy. Scopy or scopic means to look or to observe. SCOPY or scopic, SCOPIC. To look or to observe. Colonoscopy, that's looking into your colon. So let's see, gram, like an image or x-ray. Mammogram, x-ray of your breast. Another frequent one is going to be ology or ologist. That's going to be study or specialize in. Example, cardiologist, heart. Nephrologist, kidney doctor. Pulmonologist, lungs. Rheumatologist, like your joints or rheumatoid problems. So those are going to be frequent medical terms that you will hear. And then before you learn specific medical terms for various systems of the body, it's important to know word roots that identify major organs in the body. So once you identify root words and you know the organs that it applies to, when you see these big old words for these big old conditions or diseases or injuries, it won't be anything to you because you'll break it down by the root and understand what exactly it means. So dento, for example, means teeth. DENTO is teeth, like a dentist. Gastro, stomach, like gastritis. Colo, large intestines, like colitis or megacolon. Hepto, liver, hepatitis. Histo, your uterus. HYSTO, histo, your uterus, like a hysterectomy. Salpingo, SALPINGO, that's your uterine tubes. Like a histosalpingogram, that's when they give you, that's when they shoot dye into your fallopian tubes. Hysterosalpingogram, they shoot dye into your fallopian tubes to see if your tubes are blocked. It's kind of an infertility test. Dermo, DERMO, skin, dermatitis. Osteo, bones, osteoporosis. Cardio, of course, heart, like an echocardiogram or ECG. Cysto means your bladder, like cystitis. Phlebo, PHLEBO, like phlebotomy. So I have a little quiz at the end if you want to kind of quiz yourself. If you want to listen to the video again first, it's at the 10-minute mark, 10 minutes and 8 seconds. So if you want to stop here, rewind the video, listen, take notes, and then come back to the quiz, you can. So I'll read the quiz really slow in case you've already taken your notes, and you can follow along with me and answer the quiz as I give it to you. So the first question, just to make sure that you really retain some of the information in this video. So the first one is going to be, if I haven't been brushing my teeth often, I may end up with bleeding from my gums, a condition called A, hepatitis, B, colitis, C, gingivitis, D, proctitis. Now, if you don't know the definitions of some and know it of others, then at least you can do process of elimination and narrow it down as to what you know it's not. A patient, and this is number 2, a patient has a diagnosis of colon cancer and will need surgical removal of the colon. She will end up with a permanent hole in her abdomen for drainage into the bed. The permanent opening is called A, megacolon, B, colitis, C, colonoscopy, D, colostomy. Again, a patient has a diagnosis of colon cancer and will need surgical removal of the colon. She will end up with a permanent hole in her abdomen for drainage into a bag. The permanent opening is called megacolon, colitis, colostomy, or colonoscopy. So 3, you have been having chronic pain in your upper abdomen and your family physician refers you to a specialist in diseases of a digestive tract called a proctologist, B, cardiologist, C, gastroenterologist, or D, neurologist. So again, you've been having chronic pain in your upper abdomen and your family physician refers you to a specialist in diseases of the digestive tract. Are you going to see a proctologist? Are you going to see a cardiologist, gastroenterologist, or a neurologist? 4, your mother is having her uterus surgically removed along with her ovaries. Removal of ovaries is called A, appendectomy, B, hysterectomy, C, gastrectomy, D, orchiectomy. Again, your mother is having her uterus surgically removed along with her ovaries. Removal of the ovaries is called appendectomy, hysterectomy, orchiectomy, gastrectomy. So number 5, a female patient has a special x-ray procedure of her breast performed. The x-ray image is called a mammoplasty, mammoplasia, mastectomy, a mammography. Which one is it called? So the answers are, number 1, brushing your teeth is going to be gingivitis. 2, having your colon surgically removed and having a bag there for drainage is going to be a colostomy bag. Number 3, if you're going to see a specialist for upper abdomen pain, you're going to see a gastroenterologist. Gastro is your stomach, and of course your stomach is your abdomen. So if your mom is having a hysterectomy, she's only going, if your mom's having a hysterectomy, she's going to get all of her parts removed. Her ovaries, her tubes, her uterus. A hysterectomy is removing everything. So in this question, your mother is having her uterus surgically removed along with her ovaries. But the question was, removal of your ovaries is called what? It's called an orchidectomy. ORCHIDECTOMY. Even if you didn't know that, you know an appendectomy, your appendix, you know it has nothing to do with your uterus or your tubes. Your hysterectomy, you may would have figured that out because you know hysterectomy deals with your uterus. So if I would have said your uterus, you would have said yes, hysterectomy. But the question was your ovaries. So gastrectomy, you know that has to do with your stomach, gastro. So the last one was orchidectomy, which leaves you the process of elimination. That's the answer. So the last one about the female patient has a special x-ray procedure of the breast. The x-ray image is called mammoplasty. Plasty is going to be more so of a surgical procedure. Plastic. Plasia is more so of things dealing with your cells or things like that. So mammography, that's going to be like an x-ray, like we said, a graph. MAMMOGRAPHY. So your graph is going to let you know it's going to be an x-ray image. And a mastectomy, that's going to be removal of your breast. Like when someone gets breast cancer and they have to get their breast removed, it's called a mastectomy. So thank you so much for joining in this short medical terminology video. Thank you.